So we are continuing with the discussion of Entamoeba histolytica. In this video, we'll be dealing about the lab diagnosis and treatment of Entamoeba histolytica diseases. Lab diagnosis of Entamoeba histolytica. First, we'll see the diagnosis of intestinal amoebiasis. For that, we can do stool examination. Intestinal amoebiasis should be differentiated from bacillary dysentery. In the previous video, we have already seen the differences between intestinal amoebiasis and bacillary dysentery. The stool should be collected in a wide mouth container and it should be examined without delay. Stool should be inspected macroscopically as well as microscopically. So first is the macroscopic findings. The stool will be foul smelling, copious, semi-liquid, brownish black in color, and it will be intermingled with blood and mucus. In case of intestinal amoebiasis, the stool does not adhere to the container. Next, we will see the findings in microscopy. For that, first we'll do a saline preparation. In that, we'll get these findings. That is, cellular exudate will be scanty. Then RBCs are seen in clumps and yellow or brown red in color. Charcoal-laden crystals are often present. Then there will be presence of ingested RBCs, and this confirms the identity of Entamoeba histolytica, presence of ingested RBCs. Then the cyst has a smooth and thin cell wall with round refractile chromatoid bars. Actively motile trophozoites throwing pseudopodia can be demonstrated in freshly passed stools. Next is the iodine preparation. This is for the demonstration of cyst or dead trophozoites. The trophozoites will stain yellow to light brown in color. Nucleus is clearly visible with the iodine preparation and you can see a central karyosome. Cytoplasm of the cystic stage has a hyaline appearance. The glycogen masses will stain golden brown, but the chromatoid bodies are not stained. Since the excretion of cyst in stool is often intermittent, at least 3 consecutive specimens should be examined. For the diagnosis of intestinal amoebiasis, next we can take mucosal scrapings. This is obtained by sigmoidoscopy. This examination method includes a direct wet mount and iron hematoxylin and immunofluorescent staining with anti-Entamoeba histolytica antibodies. Also, we can do stool culture. This is more sensitive method for chronic and asymptomatic intestinal amoebiasis. It gives higher positivity rates. We can do polyxenic culture, and polyxenic culture is done in enriched medium with which contain bacteria, protozoa, serum, starch, etc. for the nourishment of amoeba. Media used for polyxenic culture include Boeck and Bolaf's biphasic medium, NIH polygenic medium, Craig's medium, Nelson's medium, Robinson's medium, and Bellamuth's medium. Axenic culture is also a method of stool culture, and here it is done in medium that does not require the presence of other microorganisms. While in case of polyxenic culture, we added many microorganisms for the nourishment of this organism. But here we don't use any other microorganisms. And Diamond's axenic medium is most commonly used. Axenic cultures are used for studies of pathogenicity, antigenic characterization, and drug sensitivity of amoeba. For studying all these, we can use axenic culture. Other methods used for diagnosis of intestinal amoebiasis include serodiagnosis and molecular methods. Under serodiagnosis, we have antibody detection, amoebic antigen detection, and stool antigen detection. Under molecular methods, we have DNA probes, and RT-PCR. It is real-time polymerase chain reaction. Don't think it is reverse transcriptase polymerase chain reaction. It is not reverse transcriptase polymerase chain reaction. It is real-time polymerase chain reaction. Next is the diagnosis of extraintestinal amoebiasis. For that, first we do microscopy. Microscopic examination of pus aspirated from liver abscess will demonstrate trophozoites. Pus which is obtained from the center of the abscess contain no amoeba. We have already said in the previous video that in the center of the abscess it is bacteriologically sterile area and there is no amoeba present there. Amoeba is present at the periphery. Remember that cysts are never seen in extraintestinal lesions. Only trophozoites are seen. Next, we can do liver biopsy for diagnosis of extraintestinal amoebiasis. Trophozoites demonstrated in the biopsy specimen in case of hepatic amoebiasis and amoebic hepatitis. Then the various serological tests are done. These serological tests play a very important role in diagnosis of extraintestinal amoebiasis. These include indirect heme agglutination assay, lattice agglutination test, then gel diffusion precipitation test, and ELISA. Stool examination do not have much value in case of diagnosis of extraintestinal amoebiasis. We can do radiological examination. On X-ray, the right lobe of the liver is generally found to be at higher level. Radioisotope scan of liver may locate space-occupying lesions. Then USG, CT and MRI are also useful in diagnosis of extraintestinal amoebiasis. Remember that diagnosis of amoebic liver abscess is based on detection of one or more space-occupying lesion and a positive serological test for antibodies against Entamoeba histolytica antigen. So this is the diagnostic criteria for diagnosis of amoebic liver abscess. Treatment for amoebiasis. Three classes of drugs are used in the treatment of amoebiasis. These include luminal amoebicides, tissue amoebicides, and both luminal and tissue amoebicides. Under luminal amoebicides, we use diloxanate furoate, iodoquinol, paromomycin, and tetracycline. These drugs act in the intestinal lumen but not in the tissues. Next class is tissue amoebicide. Here the drugs given are emitin, chloroquine, etc. These are effective in systemic infection but less effective in intestine. The third class is both luminal and tissue amoebicide drugs. Here the drugs given are metronidazole and related compounds like tinidazole, ornidazole, etc. They act on both sides, that is both the tissue and luminal sides. So they are the drug of choice for treating amoebic colitis and amoebic liver abscess. Next is the prophylaxis or the control measures used for preventing the infection. Food and water should be protected from contamination. Detection and treatment of carriers also play a very important role. Then health education and healthy personal habit maintenance is also very important for the prophylaxis of infections caused by Entamoeba histolytica. So that's all about the discussion of Entamoeba histolytica. Thank you.